Gauteng is now the country's epicentre of the COVID-19 pandemic, with most cases being in Johannesburg. The province reported 81,546 cases, and that's significantly more than the Western Cape that was for so long the epicentre until Wednesday. Now, this comes after Gauteng Premier David Makhura announced that he himself has tested positive for COVID-19. He's the third Premier now to have contracted the virus after Premier Job Mokgoro from the Northwest and Premier Winde from the Western Cape.
No hotspot in Gauteng. Gauteng is a hotspot.
Riding the storm and the health facilities tested to the limits.
The 80,000 mark. And it gives us that as Gauteng, we have got 34% of all the confirmed cases overall in the of confirmed cases, and we've got 47% of all the active cases as of now.
150 patients are currently being treated at the Nasrec isolation site, with plans to increase the bed capacity before August, when infections are expected to start peaking.
Will be ready with 1,000 beds. Tshwane Expo will also be ready with 1,000 beds by the end of this month. When we start the month of August and going towards the peak, we will be ready to have all the necessary capacity. We have added 440 health professionals. We are continuing to add more, 400 nurses. We are also continuing to add 400 doctors.
Overcrowding in hospitals is already a problem. Almost 5,800 patients have been admitted to public and private hospitals in the province.
Out of 81,000 people who are actually confirmed cases, and over 60 or so thousand people who are active cases, only 3,000 are actually admitted between us and the public sector. And this is the number of the people that are on a ventilator, which is 197 out of 81,000 confirmed cases. It's also important to indicate that since March, when we started our response, our first case of the pandemic, we already have admitted 5,784 patients.
On the issue of mass graves, yet another clarification.
There are no mass graves that are being dug up in Gauteng. There is no grave that is being dug up currently. The second part of this is that there is no tender to dig up graves in Gauteng. The issue that was done was to check the capacity, because part of the response plan that we have to the pandemic includes the part that we have to assess and plan on the issues relating to the capacity of the mortuary, the capacity of our grave sites.
With more educators and learners back in class, the sector has also seen a surge in the number of cases.
At grade R is embarrassing, if not low. We have presented this matter to the Provincial Command Center, whether is it economically viable to continue to open grade R, because the attendance there is less than 39%. Because of the challenges of delays in decontaminating some of our schools, the Defence Force have come to our rescue. They've made their facilities and their personnel available to assist us to clean, together with the Department of Health.
7 staff members in the office of the Ekurhuleni Mayor have also tested positive. Nozintombi Mia, SABC News, Johannesburg.
South Africa has registered a record 24-hour increase in the COVID-19 infections. More than 13,000 new infections have taken the number of confirmed cases now to over 238,000. The death toll sadly has risen by 129, which now stands at 3,720. More than 113,000 people have recovered from COVID-19. Gauteng has recorded a total of 81,546 COVID-19 infections, which is 34.2% of the nation's total, as well as 37 more deaths. The Western Cape has a total of 74,815 infections, with 37 more deaths recorded. South Africa has done more than 56,000 COVID-19 tests since Wednesday, and that brings the overall total now to 2 million.